The assessment of the respiratory system is a critical aspect of nursing care, as it helps identify any abnormalities or disorders affecting the patient's breathing and oxygenation. This comprehensive guide provides a step-by-step approach to assessing the respiratory system, enabling nurses to gather accurate data, identify potential issues, and formulate appropriate interventions. First, preparing for the assessment. Review the patient's medical history, including respiratory conditions, allergies, and medications. Ensure a quiet and comfortable environment for the assessment. Gather necessary assessment tools, such as a stethoscope, pulse oximeter, and respiratory rate counter. Explain the purpose and procedure of the assessment to the patient, ensuring their cooperation and comfort. Second, observation and general assessment. Observe the patient's breathing pattern, rate, and depth at rest. Assess the patient's respiratory effort, noting any signs of increased work of breathing, such as nasal flaring, use of accessory muscles, or retractions. Inspect the patient's skin color for any signs of cyanosis or pallor. Assess the patient's level of consciousness and ability to speak in complete sentences without significant dyspnea. Third, respiratory rate and pattern assessment. Count the patient's respiratory rate for 1 full minute, noting any abnormalities. Observe the patient's breathing pattern, noting regularity or irregularities, and any signs of respiratory distress. Assess the depth of respiration, whether it is shallow or deep. Fourth, auscultation of lung sounds. Position the patient appropriately, ensuring access to the posterior and anterior chest. Use a stethoscope to auscultate lung sounds systematically, comparing both sides of the chest. Start with the posterior chest, listening to breath sounds in the upper, middle, and lower lung fields. Proceed to the anterior chest, auscultating over the same lung fields. Differentiate between normal breath sounds, vesicular, abnormal sounds, such as crackles, wheezes, or raunchy, and absence of breath sounds. Fifth, percussion of the chest. Perform percussion to assess the resonance and density of lung tissue. Begin by percussing the posterior chest, moving from the apices to the bases bilaterally. Continue percussion to the anterior chest, comparing corresponding areas on both sides. Assess for areas of hyperresonance, dullness, or abnormal percussion notes that may indicate underlying conditions. Sixth, palpation of the chest. Use the hands to palpate the chest for any tenderness, masses, or abnormal sensations. Assess for tactile fremitus by placing the hands on the patient's back and asking them to repeat a phrase like 99. Compare the symmetry of chest expansion during inspiration, noting any areas of decreased or unequal expansion. Seventh, oxygenation assessment. Measure the patient's oxygen saturation level using a pulse oximeter. Monitor the patient's color and capillary refill time as indicators of peripheral oxygenation. Assess the patient's need for supplemental oxygen or any devices such as nasal cannula or face mask. Lastly, additional assessments and collaborative interventions. Assess the patient's cough, including its characteristics, frequency, and production of sputum. Evaluate the patient's ability to perform deep breathing exercises and use incentive spirometry. Collaborate with the healthcare team to order diagnostic tests, such as chest X-ray, pulmonary function tests, or arterial blood gas analysis, based on assessment findings. Document all assessment findings accurately and communicate significant findings to the appropriate healthcare providers. In conclusion, a comprehensive assessment of the respiratory system is vital for nurses to identify any deviations from normal respiratory function and provide appropriate interventions. By following this step-by-step guide, nurses can conduct a thorough and systematic assessment, ensuring the best possible care for patients with respiratory conditions or concerns.